Hello and welcome to our presentation on Ohio Physical Therapy, Supervision and Delegation to Assistance and Aids. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The physical therapist performs the following, none of which may be delegated: interpreting available information concerning the referral, providing the initial evaluation, developing the plan of care, including short and long-term goals, identifying and documenting precautions, special problems, contraindications, anticipated progress, and plans for reevaluation, selecting and delegating only appropriate tasks in the plan of care, designating or establishing channels of written and oral communication, assessing the competence of the physical therapy assistant, other licensed personnel, and unlicensed personnel to perform assigned tasks, directing and supervising the PTA, other licensed personnel, and unlicensed personnel in delegated tasks, and reevaluating and adjusting the plan of care when necessary, and performing the final evaluation, determining discharge, and establishing the follow-up plan. Delegation in physical therapy is the sole responsibility of the physical therapist. The responsibility of the physical therapy care rendered by the PTA and other licensed personnel rests with the supervising PT. The PTA may review medical information and/or review the patient's medical history and past functional ability through verbal contact with medical persons, family, or the patient. This information may then be used by the physical therapist to determine the need for a patient evaluation. A PTA may progress a patient treatment program within the parameters of the plan of care as established by the supervising PT. The PT may assign treatment procedures beyond the scope of entry-level PTA practice in accordance with the PTA's ability, provided that the supervising PT and the PTA have documented training and demonstrated competency in the procedure. A PTA may adjust a treatment procedure in accordance with a change in patient status within the established plan of care. A PTA may respond to inquiries regarding patient status to appropriate parties within the healthcare system and within the protocol established by the supervising PT. The PTA shall refer inquiries regarding a patient's prognosis to the supervising PT. The PTA may reinforce the PT's position regarding the patient's prognosis, and the PTA may gather historical information about the patient to perform a screening that may determine the need for physical therapy intervention. This type of screening does not include physical contact with the patient. A PTA may not initiate or alter the plan of care without prior evaluation and approval by the supervising PT. PTAs are not qualified to interpret physician referrals, conduct initial patient evaluations, write initial or ongoing patient plans of care, conduct reevaluations of the patient, or make changes to the patient plan of care, or perform the discharge evaluation and complete the final discharge summary. A PTA may only be supervised by a PT and may not be supervised by any other person, including those persons licensed to practice in any other profession. Supervision of a PTA does not require the supervising PT be on site or on location. The supervising PT must be available by telecommunication at all times and be able to respond appropriately to the needs of the patient. The supervising physical therapist means the PT who is available to supervise the PTA, the student PT or student PTA, or other licensed personnel or unlicensed personnel. The supervising PT may be the PT who performed the initial examination or another PT with whom the PT has a formal or informal agreement with. All documentation must be co-signed by the supervising PT. The co-signature shall indicate that the supervising PT reviewed the written note and agrees with the patient information in the written note. A handwritten signature or electronic signature is acceptable whenever a PTA signs his or her name. All PTAs shall use the credential PTA following their signature to indicate licensure as a PTA. As of now, Medicare requires that therapists in private practice or employed by a physician group be on site when an assistant is treating a patient. The 2025 proposed physician fee schedule will change that rule to general supervision so that therapists can be off-site when assistants are treating patients, though therapists will need to be available by phone. For states with more restrictive supervision levels, such as direct supervision, those therapy services are always furnished to the extent that is permitted under state law. And if it's required that you be on site by state law, you will still need to be on site when treating a Medicare patient. Most payers and state Medicaid programs defer to the state's physical or occupational therapy board rules for the supervision of assistants, but may require more frequent reassessments. TRICARE follows the Medicare rules and requires on-site supervision and have yet to propose a change to that rule. Aides or licensed personnel is any person who is on the job trained and supports the delivery of physical therapy services by personally assisting the PT, PTA, student PT, and or student PTA while the therapists or students are concurrently providing services to the same patient. Licensed personnel may be assigned routine duties that assist in the delivery of physical therapy care and operations, such as maintenance and care of equipment and supplies, preparation, maintenance, and cleaning of treatment areas, transportation of patients, office and clerical functions, assisting patients preparing for, during, and at the conclusion of treatment, such as changing clothes, assisting during transfer, and altering position during treatment, personally assisting the PT, PTA, student PT, and or student PTA, well, the physical therapy personnel or students are concurrently providing services to the same patient. Prohibited tasks include any services that require the training and expertise of a PT or PTA. Direct supervision is required, which means that the PT or PTA is in the same building and available to immediately respond to the needs of the patient. The PT or PTA shall have direct contact with the patient during each visit. Medicare, TRICARE, and most Medicaid programs expressly state not to bill for the services of aides. Most private payers state that services must be performed by a licensed therapist or an assistant under their supervision. Do not bill for services provided by aides unless the payer guide expressly allows you to. I've never seen a payer allow billing for aid services and really would recommend never doing it. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.